for me, coming from a background of international development work, working in very resource constrained environments and working on poverty reduction, I'm always thinking dollars and cents, and thinking about this statistic that most Americans can't afford a $500 unexpected expense really hit me that, okay, so unless insurance covers this, most people are not going to be able to afford psychedelic therapy.
Hey, joining me here today on the Psychedelic Spotlight podcast is Sherry Rais, who is the CEO and co-founder of Enthea, a mental health company dedicated to providing access to safe and affordable psychedelic-assisted therapy, beginning with ketamine therapy. As a public benefit corporation, Enthea is prioritizing the removal of health equity obstacles that impede people from receiving impactful mental health care services. And so with that, Sherry, welcome to the podcast. It is a pleasure to have you here with us. How are you doing today?
I'm doing wonderful. Thanks for having me, David.
Yeah, we're very happy to have you here and very happy to be able to have this opportunity to spotlight Enthea. I think what you folks are focused on here is so fascinating, because I think so much of the conversation here in the psychedelic space and psychedelic community up to this point, at least in my opinion, has been on the biotech companies and the companies involved in the different clinical trials involving psychedelic drugs and psychedelic assisted therapy. But there's this whole other side involving accessibility that I don't think has gotten nearly enough attention as it should. And Enthea really is focused on enhancing accessibility. And you folks have really taken a very specific approach into how you're trying to tackle this challenge of accessibility, basically looking at employers and saying, all right, you obviously want to create happy, healthy, and productive workforces, employees and their families, and everyone has access to health benefits for their physical and mental health. But why not add in ketamine therapy? Because we're obviously seeing a lot of fantastic data and information coming about how ketamine therapy can really, in many instances, inspire breakthroughs for individuals who have just not been able to find relief through traditional therapies and, in some instances, drugs for different mental health conditions such as depression, anxiety, and PTSD. Ketamine therapy is helping a lot of people. And so I love that you have taken this approach. And so I'm curious, Sherry, how did Enthea come to be, and how did you get it all started?
Yeah, thanks for asking, and thanks for that great introduction into what we do. It really came out of the need and realization, like you said, thinking about access and affordability, that in the psychedelic ecosystem, there are a lot of people working on biotech. There are a lot of great ideas happening. There's people working on research and clinical trials, but there isn't enough focus on access. And we, as people working in this space, know how powerful and helpful these medicines can be, but we also know how expensive they can be. And for me, coming from a background of international development work, working in very resource constrained environments and working on poverty reduction, I'm always thinking dollars and cents, and thinking about this statistic that most Americans can't afford a $500 unexpected expense really hit me that, okay, so unless insurance covers this, most people are not going to be able to afford psychedelic therapy. And so many people need it, and so many people are suffering, but it's going to be out of reach for most of us. So that's really kind of what led to the idea of creating a pathway for people to have access to these medicines.
And I think that's so important, because what strikes me the most on a personal level is what got me involved in this space, and what really motivated me to get involved in the psychedelic community here is I lost my father in 2018 after a long battle with alcoholism and depression. And it was shortly after his passing that I started to come across stories and information about many people across society finding relief through psychedelic assisted therapy. But once I started to see the price that was associated with it, I was frustrated because my thought process was, well, okay, even if this had been more readily available to my father as he was going through his struggle, the reality is, my family and I, we wouldn't have been able to afford it. We grew up relatively poor on the low end of the middle class. So we wouldn't have been able to afford it. And so what I love is that, insurance, obviously getting insurance companies to buy in is going to be huge from an accessibility standpoint. So I'm curious here, how has the conversation been? I mean, are insurance companies relatively receptive to this? Is there any pushback? What have you found so far?
Yeah, so I want to highlight first, perhaps maybe like the difference in when we're talking about accessibility and affordability. Accessibility is the ease which people can access a certain type of therapy, in this case, psychedelic therapy. And that can be limited by the availability of providers, the geographic location of providers, their wait lists. We know how hard it is, like with a mental health professional, to even just see one because they have long wait lists. And then affordability is the ability of people to pay for this. So that's more referring to the cost. There's a lot of issues with psychedelic assisted therapy on both sides of this equation, both the access and the affordability. Psychedelic assisted therapy costs a lot. And also there's a limited number of providers who are trained in this type of therapy. And then that number is even more limited if you go to rural or outside of urban areas. So that's why we look at certain, different models of maybe group or at-home models of psychedelic therapy to more touch on that access issue. So yeah, I just wanted to make that distinction. And then in answer to your question about the reception of this, well, really, Enthea was formed because in conversations with larger insurance carriers and in looking at the market, large insurance carriers are still very far away from covering this. They don't have the expertise in-house. They haven't built out the medical policies yet. We fortunately recently got CPT codes approved, which is a great step in the right direction, but it doesn't mean that insurance carriers are going to be covering this anytime soon. So we kind of created a pathway for access and affordability through Enthea for employers to add this on as a ancillary or added benefit.
And I think that's great because when you look at employers, obviously we know they spend in some instances, millions of dollars on employee health benefit programs, all designed to try and provide an environment for their employees where they can live happier, healthier lives. Their families can live happier and healthier lives, because typically a happy and healthy employee is a more productive employee. So you understand why there's the investment there. But as I talked about at the top, the reality of the situation is, many of the resources that are available out there designed to help people, whether it's physically or mentally, aren't really working for everyone. And ketamine assisted therapy in this particular instance is something that is really demonstrated to be an opportunity for individuals suffering from, whether it's depression or anxiety or PTSD, to experience real breakthroughs with that. So to me, it makes sense why you would want to have ketamine therapy added on to a health benefit program. As you're talking to employers out there, I mean, and you mentioned ketamine therapy, is it like, what are you talking about? That's a recreational drug. Is there an educational process involved there?
Yeah, there is definitely an educational process involved. And I really appreciate how you mentioned that mental health is so important to employers because of how it affects employees' productivity. And our existing treatments, as we know, aren't that effective. So antidepressants have been shown to only work in about 15% of the people that take them. And they come with a lot of side effects, and most people don't take them for more than 2 months, even though they should be taking them for longer. And then even with talk therapy, there's data that shows that only 35 to 40% of patients, 35 to 40% of patients don't improve with talk therapy. So there's an education component. Before we even get into the education component about ketamine, there's an education component with employers about existing treatment options. What we've seen since COVID is actually a lot of employers focused on their employees' mental health and well-being because COVID impacted everyone so greatly. What employers don't realize is a lot of the programs that they've implemented, it's great that they're focusing on mental health, aren't actually working and aren't leading to results. So that's the first education component we tackle. And then the next piece is actually about the benefits of ketamine. So we talk to employers about how, for example, 89% of people who take ketamine therapy report improvements in mental health. 63% of them see like a greater than 50% reduction in their symptoms of anxiety and depression. So there's a whole education component around ketamine therapy. And it's an interesting one because it's been around for decades. We've been using ketamine for a long time. So yeah, there definitely is that component.
And so I guess my question here is, ketamine is at the forefront of it right now because it's readily available. In some instances, it's it received FDA breakthrough therapy status. So there are ketamine clinics out there offering ketamine-assisted therapy. We know what's happened, in the state of Oregon and Colorado recently legalizing the psilocybin therapy initiatives there, specifically for mental health purposes. As Enthea continues to grow here over the next few years, are there plans to try and incorporate some of these other psychedelic medicines, such as psilocybin?
Yeah, definitely. Definitely part of the plan. In fact, the way we're building out our provider network right now is even with the providers that we're bringing in that work for ketamine assisted therapy, we ask them if they've been trained with MDMA or psilocybin. So we're keeping that in mind. We're basically creating the infrastructure and building the foundation of what psychedelic therapy as a workplace benefit looks like, such that when MDMA and psilocybin become approved, this can be a very easy to turn on option. So the idea is that I think MDMA is scheduled to be approved sooner or before psilocybin assisted therapy. And once that's approved, we're hopefully going to be in a position where we can turn this on and employers, existing customers of ours can choose to add this as a benefit.
Yeah, I think that's exciting, and being able to lay the foundation now, I think, is so important because we know the progress that's being made. We know, MAPS in the work that they're doing with their clinical trial with MDMA. So it seems to be right around the corner. So I like that you're already starting to prepare for that. I know you were it's Psychedelic Science 2023, the conference. I just want to get kind of your take and your thoughts on that because for me it was mind blowing. Seeing the turnout that was there, and really just kind of a reinforcement of, my goodness, this is really happening. I think those of us that work in the psychedelic space, sometimes we find ourselves in a bit of a vacuum. We think this is the biggest thing ever. But we don't realize that many people outside don't really know what's going on. So I felt like this was a real sign that this is really happening. This is picking up momentum. So I'm just wondering, what was your take? What was your perspective from the conference?
So thank you for asking that question. I had a really interesting experience of being at Psychedelic Science. I was so grateful to get a chance to speak about what Enthea is doing and about access. There and being overwhelmed like we all were with close to 15,000 people in one place. And the feeling I had while at Psychedelic Science was like, okay, this is really happening. Like we've hit a new milestone. This is probably now much more mainstream than we thought. From my wearing my Enthea hat, like it's going to be so much easier selling this to potential employers because clearly this is like a big deal and it's getting media coverage everywhere. And I went from Psychedelic Science literally the next week to a conference called Collision, a tech conference in Toronto with 40,000 people, not 15,000
Wow.
people. And I got to speak there, which was also great, but it was such an interesting juxtaposition of, oh wait, reality check, this still isn't we are still in a bubble, because I went to that conference, spoke about psychedelics. It's the first time they had someone speak about psychedelics there, and was bombarded afterwards with people who had questions, which was great. Most of them had never heard about psychedelic therapy. Most of them were coming to me being like, I've been struggling with depression, I've been struggling with anxiety, tell me more, I've never heard of this. They hadn't heard of How to Change Your Mind on Netflix, or they haven't
Wow.
heard of Michael Pollan. And I was like, okay, I'm still living in a bubble then. So my experience was I think I experienced that thing of this is becoming mainstream, and then immediately was like, no, reality check. We still have a while to go.
Yeah, we do. One thing I noticed with you, Sherry, is you're very passionate about what you're doing here. And I'm curious, is there a personal element to the work that you do here and the time that you invest into Enthea? I know a lot of folks in the psychedelic space, we're in this because of personal passion, personal reasons. I'm just curious to kind of understand, what fuels you on a day-to-day basis to do what you do.
Yeah, thank you for asking. There is a personal element for me, and I think it goes beyond just having my own issues with mental health and my own healing journey. For me, it's been really broader. Going back to, like, if I trace the roots in my childhood, I grew up in a community and in a family where service was very emphasized. We have a word in our community called seva, and it's the act of, doing service. So from like the age of 4, I was taught to volunteer and the importance of being a volunteer. And that led me down a whole path, a career path, and a life path of dedicating myself to serving others. And I spent 10 years working in very difficult, challenging environments, consulting with the UN and the World Bank. And I was focused on poverty reduction because, to me, the idea that we have enough resources in the world, yet people are struggling to eat, just doesn't actually make sense, still does
Right.
not make sense to me. And sorry, it's a long answer to your question, but the personal side for me was, after a decade of working in poverty reduction, I worked in 37 countries. I implemented different programs at the national level, and I came out of it seeing, okay, we can do a lot to reduce poverty. We can actually give people food. We can redistribute resources. We can give people access to good healthcare, good education, good jobs. We can build roads. We can make sure people have internet. But if we don't address mental health, there's going to be a huge part of the population that doesn't get to come out of poverty. And so I felt like I spent most of my life's work was focused on this thing, and I wasn't addressing the main need. And yeah, that's deeply personal to me, because what's fueling me every day is like, why are there still people suffering?
Yeah.
Why? We have tools, we have ways to get out of this. And so actually, and tying this all in, I recently I'm super grateful and honored. I got to write an article for a publication that serves international aid workers and serves people working in communities like I was working in. And it's the first time a publication for international development workers focused on psychedelic therapy. So I got to write about the potential of that in those communities. And that's actually really exciting to me.
Yeah, and I love what Enthea is focused on. It's a very specific solution to a problem. I think I've spoken with many different people across the psychedelic space, and what encourages me is there's this real passion to want to make sure we do things differently here, and to make sure that affordability and accessibility both are in line with one another, because you talked about earlier, they're two different things. And I feel like there's enough interest here and enough motivation to want to make sure that there are solutions put into place to ensure that psychedelic assisted therapy is available to everyone. And Enthea, really is focused on how you're going to do that specifically. So I really am encouraged by the work that you're doing here. Just a question off the top of my head here that I'm kind of curious about is, as you go out there, do you take the approach of trying to get with the companies first, basically saying, this is something you want to offer your employees? Or is the approach more to the insurance companies? This is what you should be telling your clients, the companies, that they should be offering. I'm just curious what the approach has been like, because this is kind of new work here. Like, this is something that no one has really done before. So just curious how you've gone about that way.
Yeah. So we're definitely trying different approaches, and not sticking to one lane, because we want to get this out there. But our focus has been on talking to employers. When we are talking to employers about offering this to their employees, the approach will depend on first whether or not they're psychedelic curious or psychedelic open. A lot of times we're talking to companies where a C-suite or a founder or a decision maker at the company may have had a personal psychedelic experience or may have had a family member that's had a psychedelic experience. And the conversation in that case is much easier, to be honest, because we're speaking the same language. We know the effects of this. We know how this helps. But we are definitely talking to a lot of employers who haven't had a psychedelic experience. And in that case, we're really talking to them about, there's different things that companies are aware of. Like, for example, 83% of employees right now in the US have work-related stress. And 90% of people that left their job last year felt burnt out. And that's the number one reason for actually Gen Zers and millennials to leave their job is mental health issues or burnout. And more than half of employees in this country are saying they're not receiving the mental health care that they need. And also more than half of them are saying they place more importance on a healthy work-life balance and getting mental health benefits than they do on financial compensation now. Like, to a certain point, of course, they need to get paid enough, but beyond that, they're caring more about the benefits, more about the work-life balance than they care about their pay. So we're really having these conversations with employers. Like, most employers know that if they're having an employee that's dealing with a mental health issue, they're not productive a third to half of the time while they're at work. What employers don't know until we talk to them is it's actually not just if their employees are dealing with a mental health issue. It's even with somebody at the household of the employee. If they're dealing with a mental health issue, if their partner is dealing with a mental health issue, that's going to affect the employee's productivity as well.
And I think this is when we talk about not wanting to do things the old way. I think this approach and being able to look at the many different dimensions that are involved with what ultimately helps create an environment for employees to be happy, to be healthy, and to be productive. In the past, it was pizza party, a pizza every Friday, or things like that. But I think we've learned that that's just not enough. There's so much going on, and that doesn't, it's not restricted to just the workplace itself, but like you said, it goes beyond into their everyday life at home, and it could be something with a family member. And so I love this approach. Someone that has spent time, working in human resources and in health benefits. I think this is how you really go about creating a very happy and healthy workplace. So I really love this approach. And so for any employers out there, if there's a CEO of a company, or a C-suite, listening to this podcast right now, or an employee who says, I wish my company offered this, where could they go to get the process started here?
Yeah, they can go on our website. They can email us at info@enthea.com and we'll give them more information. I would start off with that, or they can connect with me directly. They can email me, message me on LinkedIn. My email is sherry@enthea.com. I'm happy to have a conversation with anyone and give more information. Especially, really, I care a lot about talking to employees who don't know how to have this conversation with their boss or with their HR department. So I'm always happy to have that conversation.
Yeah, because I can imagine walking into the boss's office saying, "Hey, I'd like ketamine therapy to be an add-on to our health benefit program." So that's probably not an easy conversation to start off with. But listen, it's becoming more normalized. The information's out there that points to this being a safe and effective therapeutic option. It just takes research and time on that, but. Sherry, this has been fantastic. I really have enjoyed this conversation. Again, I really appreciate the work that you're doing here, and I look forward to continuing to follow the progress here of Enthea. So thank you so much.
Thank you so much, David. Really appreciate this.
Great.